Well, my friends, the two genital organs of female, are indispensable for living to production of the new life. That is, one uterus and one is breast. Uterus is an essential organ to formation a new life, to keep the asylum, the place for a new zygote. So, the man production asylum. And breast, after birth, the child, for living, for maintaining the life, first sucks the nipple of breast of his mother. So these organs are essential to a woman, but these two organs are very dangerous. Often the breast becomes proliferates and there is formation of tumor from benign to malignant. So there are two types of tumor we know from our knowledge of pathology, benign and malignant. Benign means non-cancerous and malignant means cancerous. Now the breast tumors may be benign, may be malignant. Uterine tumors are also benign and malignant. Generally many tumors, uterine fibroids, at first time non-malignant. The tumors may form within the endometrium of uterus, which is known as endometrial tumor. It may appear at outside of the uterus, that means over the body of the uterus, within the muscles of the uterus, myometrium, etc. This is a picture I am showing you to show the uterine fibroids. These are within the intrauterine cavity. These are over the body, over the fundus, etc. This is the fallopian tube, this is the ovary, and this is the fimbriated end of the fallopian tube. And this is the vagina, and this is the uterine canal. So these are the types of uterine fibroid. So many patients, many women are suffering from these uterine fibroids. These are generally, I have already told, non-cancerous growths in the uterus that can develop during a woman's childbearing years. Now, how you have to know, how you will identify, how the physicians or the patient herself will understand that she has been going to suffering from tumor in the uterus. There is history of heavy and prolonged periods. There is heavy prolonged periods between the periods, between the two cycles, between the two menstrual phase, which is known as metrorrhagia. Metro means maskane, middle of the two uterine phases. So metrorrhagia, pressure in the abdomen sensation of pressure in the abdomen, and pelvic pains. Fibroids are most often found during a routine pelvic examination or incidentally noted on imaging like ultrasonography or CT scan. So this is our uterine fibroid. So we have to learn that uterine fibroids are common growths of the uterus. They often appear during the years, usually able to get a lady when get pregnant and give birth. Uterine fibroids are not cancer and they almost never turn into cancer. They are not linked with a higher risk of other types of malignant cancer of the uterus. Now these fibroids vary in number and size. It may be a single one or more than one. Some of these growths are too small to see, the surgeon can see with the open eyes. Others can grow to the size of a grapefruit or larger. A fiber that gets very big can distort the inside and outside of the uterus. In extreme cases, some fibroids grow large enough to fill the pelvis or even up to the stomach area. They can make a person looks like a pregnant lady. Many people having uterine fibroids sometimes during their lifetime, but this is due to without any cause, or maybe said idiopathic. So there are types of fibroids. Heavy menstrual bleeding are the symptoms, or painful periods, longer or more frequent periods, pelvic pressure or heaviness sensation in the lower abdomen, and there may be also frequency of urination as it gives to the bladder. Posterior wall of the bladder, the uterus, just in front of the uterus, there is bladder, and the large tumor may give pressure to the trigone or posterior part of the bladder, and there may be sensitization of the bladder which cause frequency of urination. There may be constipation. When the tumor grows at the back side of the uterus, back wall, it gives pressure to the rectum, and thereby passing of stool becomes very difficult, and the subject may suffer from constipation. Or during pain during sexual coitus, which is known as dyspareunia, it is also a symptom of uterine fibroid. Now, can homeopathic medicines control the uterine fibroid? If it is benign in nature and it is a growth, some antipsychotic medicines is required because psychosis means proliferation. Here is the case, my friends. A gentle lady, age about 35 years. I do not like to show the face of the patient. This is the appearance of the patient. A 35 years aged lady was suffering from uterine fibroid. By prescribing only single medicine, T. occidentalis, considering the miasmatic background, which is followed by medurinum, and the tumor is reduced in size. I am showing the ultrasonography reports of this patient, my friends. This is the name of the patient, aged about 35 years, and the report dated is 30th March 2023, just 1 year back's report. Referred by Dr. B. Tikadar. The uterine fibroid was sized 2.47 into 1.88 centimeter, 2.47 to 1.88 centimeter. After 1 year treatment, the patient has again done USG. The same patient, the same age, referred by Dr. Robin Burman, and the result is a small posterior uterine fibroid. The fibroid from 2.47 to come down into 1.9 centimeter, 1.9 into 1.8 centimeter. So, no doubt, within 1 year of antipsychotic treatment, the fibroid is reduced its size, and they have clearly mentioned a small posterior uterine fibroid. Is it not a success of homeopathy? The patient is still having the fibroid, but very lesser than the previous result, and I do hope further continuing of treatment, the tumor or the fibroid will totally go away.